And hello, it is just afternoon, and this is Friday Lunch and Learn with me, Dr. Polly Heil-Mealey, here at Abundant Health and Wellness. Now, we want to continue our discussion from last week about iodine therapy, and I've got all kinds of things on my desk, and I'll be looking at different studies from time to time. But one of the things that we talked about last week was iodine and breast health. But when I've been studying this, iodine is beneficial for many things, not just the breast. So we want to kind of get in on this study and talk about what this actually means. So we are looking at a study by Dr. David Brownstein. He is a medical doctor. He also does a lot of holistic things, and he is really renowned in the holistic medical practice. So we know him and we love him. And so I know that this is a really good, credible study. Thanks everybody for joining, and be safe driving and all that kind of good stuff. So we want to talk about iodine and what we can do if we are iodine deficient. So last week, as I said, we talked about iodine and breast health, and we found that a healthy woman needed to have at least 11 milligrams of iodine per day in order to take care of the needs of the breast and the thyroid. So if you're a gentleman, you need a little bit less because you don't have breast tissue like women do. But we need to know exactly there are other organs and different things. So this particular study talks about iodine. Now, what you need to know, if you have a chance or had a chance last week when we talked about the periodic table and the different elements on that periodic table, I pulled it up on the web page just a while ago, and it is the halogens. And so you might know of halogens as in halogen lighting and that kind of thing. But this particular strip on the periodic table is called the halogens. And so you've got chlorine, fluorine, bromine, and iodine. So all of these elements are in the same family there. And so don't want to kind of bore you with that, but you need to know because the iodine receptor, certainly on the thyroid and all in the other parts of your body, if you have toxic elements of bromine or fluorine or chlorine, any of those kind of things, then they are going to attach themselves to those receptors, so your body is not going to be able to metabolize and uptake the iodine. So this is what we want to understand, is that we maybe have some toxic load, heavy metals, and so we need to move forward on that. Now, there's some very interesting studies on this, and so I'm going to try and not bore you. I'm trying not to go too long, but I want to give you some information because information is power. When you know what your body needs and you give your body what your body needs, then it has the ability to heal itself. So just as a review, last week we talked about the recommended daily adult dosage is 150 micrograms. That is 1/1000th of a milligram, right? So 150 micrograms. So we know, we just said that the breast and the thyroid need 11 milligrams. So your RDA is sadly lacking. So this particular study, they studied, I don't remember how many they studied. Hang on a second. I think it was 300 people that they studied, okay? And they said that, okay, so after testing, here we go. After testing 500 patients, I found that 94.7% of the patients were deficient in inorganic iodine. Many of these patients were already being treated by me for thyroid and other endocrine imbalances, okay? When the physiologic dose of iodide was added to the regimen, many of these patients showed dramatic improvement in their condition, especially people who were non-responders on ordinary therapies. So we need to understand that you could be on thyroid medication, either Synthroid or Armour Thyroid or Nature-Throid or whatever, and if you've not got iodine, you're not going to process that thyroid hormone. So this is something that we need to know about that, okay? So iodine deficiency sets up, and this is from Dr. Brownstein, iodine deficiency sets up the immune system for malfunction. So whenever we are here in the clinic, what we're seeing is more and more people are coming in with autoimmune disorders. They've got Sjogren's, they've got lupus, they've got rheumatoid arthritis, they've got chronic fatigue syndrome, they've got fibromyalgia, they've got Lyme, they've got all these different diseases. And so just wondering about what iodine would do in those situations. He says, Dr. Brownstein says, every patient could benefit through a thorough evaluation of their iodine levels. Now, what happens with an iodine level is that you do a urine test, and we can do this here in the clinic. We obviously don't test it here, but we can get your sample here, and then we can send it off to our labs. And what that does is it tests how much iodine you are secreting in the urine. If you are sufficient in your iodine, you will be secreting 90% of all of the elements. 90% will be iodine. So this particular test tests for iodine, bromine, selenium, arsenic, cadmium, mercury, and creatinine. So these are the different substances, toxic substances, that can take up residence where your iodine receptors are. So if that's happening, then your iodine has nowhere to go. As you recover, as you start getting more iodine positive or iodine sufficient, you're going to have more and more iodine secreted because your body doesn't need it. So I hope that makes sense. Iodine deficient people, when they do this urine test, they're going to have maybe a 10%, maybe 20% iodine in the elements. What you want to do is have enough iodine in the body so you're peeing away all the excess, which would be about 90%. So we are able to do this test here in the clinic. You are also able to go to your doctor and ask for that test. Now, a lot of times when I'm talking to my mom and I'm saying, Mom, you need to go ask your doctor to give you this test or that test, and she comes back and she goes, I'm at the doctor's, they have no idea what you're talking about. So sometimes this might be new. We might have to educate our doctors into helping us get the kind of things that we need. So those are some things that we're going to be looking at. So a deficiency in iodine also leads to cysts and nodules on the thyroid gland. So you may have been told you've got nodules. You may have been told you've got parathyroid nodules. So this is a clear sign. If you've got nodules on your ovaries, if you have polycystic ovary disease, then this also is an indication that you are thyroid insufficient. So we need to know what that is and know how to fix it, right? So, this is a fact. Okay, this is a fact. Iodine levels in our food, iodine levels have fallen 50% in the last 30 years. On retesting, in the last 50 years, autoimmune disorders and hypothyroid symptoms have been increasing during that same time period at almost epidemic proportion, and these are Dr. Brownstein's words, all right? We can see improvement in iodine in as little as 90 days, so that is exciting. He said, why would people need a larger dose of iodine? Remember, larger is larger than the RDA of 150 micrograms. Why have iodine levels fallen 50% in the last 30 years? This is Dr. Brownstein talking. As I have pondered the questions, I came to conclusion that the toxicity of modern life must be impacting iodine levels. It is well known that toxic halides Fluoride, bromide, having similar structure as iodine, can compete and inhibit the iodine absorption and binding in the body. So just kind of want to stop right there with that and come back with a study, right? So bromine. So what is this, okay? The bromine is a element. Now, used to, bread was made with iodine. Iodine made it nice and fluffy and that kind of thing. Well, now, I think in the 1980s, and I may be a little bit off on that date, I'm sure somebody out there will correct me, we stopped using iodine in the bread and we started using bromine in the bread. So bromine attaches itself to the iodine receptors in all of your organs. So these are some symptoms of bromide toxicity. So one of them is cherry angiomas. So I don't know if you know what cherry angiomas are, and I can't really show you. Maybe I can try. There on my arm right here is a little bitty pink, looks like a little bitty strawberry. That is a cherry angioma. Cherry angiomas come when you have too much bromine in your system. Bromine, bromide, they're just different variations of that same chemical element. You also can have a lot of fatigue when you have bromide. You also can be very, very susceptible to a lot of headaches, okay? You also can have a rash. When you have bromide toxicity, you have rashes on your skin. You can also develop tremors. And I know a lot of people that come into the office and they have tremors. You can also have acne. So we don't want to do that. You can have disturbance in your color perception. You can have memory impairment. You can have concentration impairment. We have a lot of people that come in and they've got brain fog and that kind of thing, and they think they're just having senior moments, and they may be having a senior moment, but really it could be that they've got toxicity of bromide there. You could have abnormal pigmentation in your skin. So when you've got the liver splotches or you've got the reversed where you're losing pigment. Now we know that that is an autoimmune disease. It's called vitiligo, but it could be that that is part of an iodine insufficiency. What about slurred speech? Now, we're not talking about people that, kind of a little hungover and that kind of thing. This is slurred speech when you're just talking and all of a sudden things go crazy, right? Hair loss, emotional irritability, anger issues, all of that could be iodine insufficiency. Reflex changes. You don't respond quickly, okay? Eyelid twitching. That is a symptom of having too much bromide. So where are we getting all of this bromide, right? We are getting it, and you need to just know it's everywhere, even though you don't eat a lot of bread. I don't eat a lot of bread, but it is a flame retardant that is used in clothing. So if you are a gentleman and you are working outside and you need the flame retardant clothing, I think they're called FMCs, then you're going to have a lot of bromine in the system. Also, it's in your carpeting. It's in your furniture. It's in your mattresses. It's in your clothing. It's in your computers. It's in your iPhones, and it's in your automobiles. So these are just to name a few of those places. Now, all of us have computers. I mean, as I'm sitting here, I'm speaking into my iPhone here with the video. I've got a computer to my left, and I've also got another monitor here. So, I mean, I'm just bombarded with all these things. And so we have to protect ourselves and make sure that we displace the bromine and the fluoride. Now, fluoride, hopefully by now, you're all drinking purified water or filtered water. Now, I drink spring water. We have spring water here at the clinic, and we also have reversed ionized water, reversed osmosis water. Thank you, Daniel. And we have that for our patients and our staff. That is the best kind of water that you can have. We also, I don't buy purified water when I buy water at the store. I buy spring water because purified water is just your regular tap water that has been bottled. And I certainly don't want to be giving that to myself or to any of my people. So those are the kind of things that we need to look at. Mountain Dew, right? If you drink Mountain Dew, I don't know how you do that because I think that is just not a pleasant taste at all. But Mountain Dew and citrus-based sodas have a lot of brominated substances. It's also in the flour, as we talked about. It's also in your vegetable oils. So you need to really, really look at your labeling. All right, I digress back to fluoride because we all use toothpaste with fluoride in it unless we're conscious of it, and we don't, right? What fluoride does is it dumbs down your emotions, right? It kind of puts you in this state where you don't have any fight in you, but it also calcifies the pineal gland. Now, the pineal gland is right up here in your brain. It's about the size of an almond. It might be a little bit smaller than that. They call it your third eye. It's supposed to be one of your master glands. Now, your glands are all of the things in your body that produce hormones, okay? So the pineal gland goes, is connected to the eye through the optic nerve. So it needs light in order to function. And so you want to have a lot of sunlight to make sure that your pineal gland is nice and healthy. Now, fluoride will go in and calcify the pineal. And what that means, calcification, is it's going to get really hard and it's not going to move and it's not going to send out those impulses that needs to. It hampers your dream. And one of the things that Dr. Brownstein said in this report is that when he gets people where they have enough iodine in their body that they are actually excreting 90% of it, that they have very, very lucid dreams. And that's because the iodine has gone in and displaced all of the fluoride and the bromide and the chlorine. And so we need to do that. We all need to do that. So we've got all of these symptoms that we've got this bromide and fluoride problem. Diarrhea, chronic constipation. If that's you, it could be these halides. If you have kidney pain, if you have dry mouth, if you have a lot of body odor and a lot of sweating. Now, we know that sweating, abnormal sweating, is a sign of heavy metal toxicity. And so we know that we need to get that resolved. And so if that is a symptom that you have, or you know people that their hands are always kind of clammy and that kind of thing, well, that is heavy metal toxicity. Remember, heavy metals, the body is going to push those elements into the fat cells, and we're going to be carrying too much weight because the body's trying to protect the visceral organs. So you need to know that. What else do I want you to know? We know that on the when we're cleaning out the body, when we're cleaning out all of these halides or halogen elements that we don't want in the body, there are some things that we can find side effects. What are some of the side effects? Let me see. A metallic taste in the mouth, acne, sneezing, excess saliva, and frontal nasal pressure. Now, I will tell you, I told you last Friday, that I had started supplementing a much larger dose than the 150 micrograms. Last Wednesday, I started that. And I did notice this week, one morning I woke up with a lot of sinus pressure, and this morning I woke up with a metallic taste in my mouth. So what does that mean? That means that the iodine is going in and it's pushing out the fluoride, it's pushing out the chlorine, it's pushing out the bromide. And so this is a good thing. That means it is working. And I told you that I did the patch test last week, or I was going to do it last week. And I did the iodine patch test. That's where you take some iodine and you paint on your forearm here, on your wrist area. You paint a 2x2 square, and then you set your timer, and you look at it every 2 hours, and you see how long it takes for your body to absorb the iodine. If you are iodine sufficient, then you will be able to absorb, you'll be able to have that patch on there for over 24 hours. If you're iodine insufficient, your body is going to take that iodine and it's just going to suck it right up. Now, when I did this test 3 years ago, my patch was gone in 2 hours, which means I'm extremely iodine insufficient. And so I have been working with things, of course, not at this level because I did not have this research and I was just going by the RDA. And I went a little bit higher than the RDA, but there's a lot of iodine phobia out there due to a study that's been debunked. So, anyway, whatever. I had not been supplementing the way I needed to. So I did, even though in the 3 years I have been supplementing, my iodine patch lasted over 4 hours. So I've improved by 100%, but I still have a long way to go. And so I am continually upping my iodine to see what kind of effects that it is going to have. I will tell you that last week I did increase it on the Wednesday, and within 20 minutes I did feel a surge of energy. So anybody that works hard, I work hard. I get up at least by 6 o'clock every day, and it's probably 11 by the time I'm settling down. So I need a lot of energy to get through my day and do all of the things that I do, and I'm sure you do too. And so this is a thing that you can implement in your life. You can increase your iodine. Obviously, we want you to do it with medical supervision, right? We don't want you to have any kind of negative effects. There's not really a whole lot of negative effects. I mean, metallic taste in your mouth is not that big of a deal. And it usually takes about 3 weeks to go away. So, you just have to suck it up, Buttercup, and get that iodine where it needs to be so that you can be healthy. I think that for me, right, and I am well past 50 now, and I don't want to have all of those things that happen to older people. I don't want to have brain fog. I don't want to have Alzheimer's, dementia. I don't want to start losing my balance. I don't want to start having bone fractures. I don't want to have any of that kind of stuff. So it is really, really important for me as a human being to make sure that my iodine levels are where they need to be so that I can live long, live strong, right? So this is kind of my quest that I'm sharing with you so that you can decide what you want to do with that. So what about if I have an iodine allergy? What if I am allergic to seafood, right? So this doctor says, my experience has shown true allergy to inorganic, non-reactive iodine is very rare. Out of over 3,000 patients treated with iodine, I have found 3 with a true allergy exhibiting the symptoms of a skin rash. These people were treated with NAET, an acupuncture treatment, and 2 were able to overcome their allergy and take iodine. 1 of the 3 patients has not been able to take the iodine due to an allergy. Well, we know that if you have any kind of allergic response, it is because of the toxic load in your body. So this is what that means. When you take in something that the body doesn't like, the body produces antibodies, right? The body mounts an immune response. When you get more and more and more things that the body doesn't like, the body gets confused and starts attacking itself. And so an allergy is a symptom that your immune system is attacking itself and it is confused. And so if you do some homeopathic remedies that we have here in the clinic, we can get your immune system unconfused, right? And we can get you doing what you need to be doing. So these are things that take some time. They're not quick. They're not cheap. But what is your health worth, okay? You've got to be, if you're going to be living a long time. I had a lady come in and she says, well, I want to live to 100. I said, well, if you want to live to 100, that's fine, but you got to do this, this, and this in order to get there. And so one of this new research that we're looking at, if you've got any kind of autoimmune disease, if you have any thyroid issue, if you have any hormone issue, if you have Crohn's disease, irritable bowel syndrome, anything like that, then what you may have is just an iodine insufficiency. Now, I'm not wanting to downplay autoimmune diseases. I'm not wanting to downplay things that are going wrong with you, that it's a simple fix with iodine. I'm not trying to do that. But what I'm trying to do is tell you that if we look at something in a little bit different way and we try a different tool, maybe you're going to get a response that's going to be different than what you've had in the past. So, as my friend Dr. Cass says, when all you have is a hammer, everything looks like a nail, right? We've got more than a hammer. We've got a whole toolbox here, and iodine therapy is just one more new tool that we're implementing here in the clinic. Now, somebody asked, what about if we are taking thyroid medication? Can we still do this with iodine therapy? Yes, you can. It says the body needs adequate amounts of iodine to properly utilize thyroid hormone. Those individuals already on thyroid medication may need to lower their dose of the medication upon starting iodine therapy. My experience has shown that 1/3 of the patients currently taking thyroid medications will need to lower their dose after starting iodine supplementation. Now, this is something that's always bothered me as a human, not necessarily as a doctor because I don't understand it. But if you're telling me that my thyroid's not working and so you give me a medication and it's supposed to make my thyroid numbers come into line, but I still have fatigue, I still have thinning eyebrows, I still have ridges in my nails, and I still have a weight issue, your drug's not doing me any good, even though my numbers may be okay on my blood test. And so this makes sense to me that with the iodine supplementation, you're going to be using your thyroid medications better, you're going to be producing more thyroid hormone or taking it better, so you're going to have those symptoms of fatigue, brain fog, ridged nails, and weight issues. Those are all going to resolve. So I'm just about out of my time. Thank you so much for all of you that have joined me. I didn't do shout outs because I got fussed at last week that I didn't get to the point. So I'm getting to the point a little bit quicker. Love you guys. Thank you so much for joining us and sharing. I appreciate that. And we will say goodbye. It is the weekend coming up. Have a blessed weekend. Stay dry and warm. And I will see you next Friday at noon. Bye.